The amount of women who tell me that they hit this age and then their boundaries become really strong. They use the word
Right.
no more often. They're figuring out who they are. I mean, there's a lot of benefit to going through this transition. I know it can sound
Mhm.
all doom and gloom. You're going to come out the other end just this whole new amazing goddess, right? However,
Mhm.
that means you put up with less crap and you set harder boundaries. And if you've been tolerating or people pleasing or, living for everyone else for decades, including your partner, then you're done with it. And that can be
Yep.
a real big jolt to everyone. And they're not willing to change because they like the way you people pleased and, put everyone else
Mhm.
first. They didn't have to work very hard. So anecdotally, I absolutely see women that are like, man, I hit perimenopause and I was done. Not the same.
Yes. Hey guys, I have someone on that I'm obsessed with, and I can't have her come on enough, apparently, because I think this is her fourth time back on. So we have Dr. Carrie Jones on the show. We're going to talk about something that we can relate to personally. So we're speaking from experience, and it's something that so many women are dealing with. And I know this is going to be so helpful for you guys to get the information you need and feel empowered and feel heard and validated. And that's what we want. So, but a little bit about my guest. She's an internationally recognized speaker, consultant, author, educator on the topic of women's health and hormones with over 20 years in the industry. She was actually my gynecology professor back in the day, my hormone professor back in the day, I think endocrinology, yes. I shadowed her. I got to, just see her in action. Her patients were so happy. I think her practice was full, like pretty fast when she was practicing. It was amazing. I learned business management stuff. I learned clinical, pearls, and I still have my notes that I still look at sometimes. Isn't that crazy? So we have the queen of hormones on. She is a naturopathic physician who did her 2-year residency focused on women's health and endocrinology. She went on to be also a high achiever and get her master of public health because apparently one, degree wasn't enough. And she was one of the first to become board certified through the American Board of Naturopathic Endocrinology. And she's a Menopause Society certified practitioner. She was also the first medical director for Precision Analytical. If you are familiar, that's the company that does the Dutch test, which I know we've talked about a lot on the show, and also the first head of medical education at Rupa Health. And she also co-hosts the highly popular show, the Root Cause Medicine podcast, and has over 10 million downloads. She has some really cool projects coming. We're not going to talk about it yet because it's secret, but I heard in the back, behind the scenes what's happening, and it's juicy. And so we'll give you the update when we can. But welcome back on the show.
Oh my gosh. I love seeing your face. I love talking to you. And it's always such an honor. So thank you.
Yeah, and I just got to see you in Vegas. Got to get our geek on, A4M.
We did. Thank goodness.
And you
So-
lectured too. What did you lecture on?
I did stress. So basically I did stress and cortisol 101 and walked people through the nervous system, the limbic system, and testing as it relates to how the heck do you know how stressed out you are?
Oh my gosh. I think we all know we're stressed, but there's different kinds of stress and all the little nuances matter. So I love that. And we are talking about perimenopause. So I thank God for social media. This information is getting out a lot more now for women to finally hear about what's happening with their bodies, because
Mhm.
I firmly believe this is probably the number one underserved segment of the population in medicine. Like I
Yeah.
really do.
Yeah.
And me, I'm turning 44 this month, and even all the stuff that I know and all the lifestyle stuff I know, I can definitely tell a difference in my body, and it can be rough. So I hope that everyone listening, you're able to just feel validated and heard with what you're dealing with. But we'll first start with, what is perimenopause? How does it differ from menopause? Because those, terms get thrown around, and I think there's some confusion about that, and what that might look like if a woman is moving in that direction.
I remember when I was in full-time private practice being in my 30s and all my patients in their 40s were like, you just wait on your
Yep.
45th birthday, you can't sleep anymore. Or
Yep.
your word
Same.
recall won't be the same, or your glass of wine that you enjoy here and there, it's going to hurt you more than help you. And I thought, no, as a
Mhm.
doctor who's a naturopathic, integrative, holistic doctor, I'll be able to figure this out. And sure enough, I definitely understand everything that happens with perimenopause. So perimenopause is this transitional time that generally, depending on the woman, is 7 to 10 years long. And it often starts in her 40s, but it can start as young as her late 30s. And it generally goes until about the early 50s. And it's a transition from you are reproductive and you're pumping out hormones in a consistent, regular, up down kind of manner, to the other side when you cross the bridge is you are no longer reproductive. Your periods will end. You will not release an egg anymore. And so
Mhm.
to get from the reproductive side of it to the non-reproductive side can feel like pure chaos because it's like reversing out of puberty. Like we all remember what it was like to go through puberty. We were getting our period for the first time. We're having all these crazy symptoms. Our hormones are gearing up for the first time ever. And now we were backing out of that. Now, what's really interesting and I really want to hit home on is that the entire definition around perimenopause and menopause, which I'll get there, is around reproduction and it's around your menstrual cycle. But of course, we are a million times more than reproduction and a million times more than our menstrual cycle. We have 12 systems in the body. So this entire transition from reproductive to non-reproductive affects every single system in the body, which is why when you're going through this transition, you may notice that you're having symptoms all over. You may notice things in your hair, in your skin, in your joints, in your vagina, in your reproductive tract, in your brain, in your eyes, in your mouth, in your gums, like in your toenails. Like you're going to maybe notice it everywhere and think, well, that's weird because it's just my hormones. Well, these hormones play a very wide role in the body, which is why, I think for a long, long time, it was brushed off or not really readily discussed, or it was sort of told to women, oh, that's normal, that's what happens, that's what's expected, or we were thought to think we're crazy as we're making this transition. Now,
Mhm.
what is menopause? Menopause is once you've gone 12 consecutive months with no period. Now, for all the women who were like, well, Carrie, I've had a hysterectomy, or I have an IUD, or I had an ablation, I don't know if I get a period. I'll get to you in just one second. If you still get your period, if you go 12 months, no period though, on the 12th month, you are considered menopausal. On the 13th month, you are considered post-menopausal. So menopause is really essentially one day. It's the day that you arrive at 12 months, no period. And the
Mhm.
rest of your life, you're considered post-menopausal. They often get interchanged, menopause, post-menopause, because it's easier to say, it makes more sense. It's just what we've been saying for a while. But it is nice to have that distinction of once you've gone no period, 13 month, you're considered post-menopausal. Now, if you
Mhm.
have had a hysterectomy, if you have a progestin IUD like a Mirena, or let's say you've had a uterine ablation and you're thinking, I don't know if I get my cycle because I don't actually bleed anymore, then it's likely your ovaries, of course, still work and they still go through this transition and you can still have these symptoms. But instead of using the definition based on your period, we tend to use it more based on age, symptoms, and then a lab test called FSH, follicle stimulating hormone. And once it gets above, depending on your lab, once you get above 25.8, some labs say once you get above 30, then you're considered postmenopausal. So that's the down on dirty between our sort of younger reproductive years through the perimenopausal transition of reverse puberty, menopause into postmenopause for the rest of our life.
Mhm. Got it. And let's say for women listening, they're like, well, I do notice some things that are feeling different. How would I know if I'm beginning that peri road? What are the earliest clues of that?
And I love this question because so many women I find brush off their symptoms or their symptoms
Mhm.
get brushed off by their healthcare
Totally.
practitioner, which is so
Totally.
frustrating.
Mhm.
So this is where we become our own best advocate and we say, you know what, I'm having these symptoms. I'm having insomnia, or I'm having fatigue, or I'm having hair loss, or I'm having hot flashes. And let's now go get evaluated. Let's figure out what are all your symptoms, what's going on in your life, and when was the last time you had some lab work. Because here's what's interesting, thyroid issues overlap in symptoms with perimenopause. If you
Mhm.
took a chart of what are the most common symptoms of a thyroid issue, hyper or hypo, and you overlap that with what are the most common symptoms of perimenopause, they overlap quite a bit. But they are not one and the same. So I would want to make sure, like, hey, have you had your thyroid checked in a while? Like, let's really check it and make sure I'm not missing a thyroid problem. Or let's say you have glucose and insulin issues. Well, that can cause a lot of fatigue and insomnia and hot flashes and weight gain, which sounds a lot like perimenopause. So let's check that too. Now, they can go back and forth. Perimenopause can induce glucose and insulin changes, but I want
Mhm.
to know these things. Are you anemic? Do you need more iron? Do you need more B12? Because guess what? Those symptoms can sound a lot like perimenopause. So you still have to advocate for due diligence. Like, hey, I haven't had blood work in a while
Mhm.
or any kind of testing. Let's see what's going on that I'm having all these symptoms. And if those are good and I kind of at that age, then it's probably perimenopause. Now, can you have both? Can you be in perimenopause and have a thyroid problem? Of course. Can you be perimenopausal and be anemic? Yeah, of course. But we won't know until we work you up.
Mhm. Yep, absolutely. And, it's like it's crazy because it's so huge how women do get dismissed with this, and then they have to kinda go, like, on a doctor scavenger hunt. It's like, I
Yes.
have these itchy ears, I'm gonna go to an ear doctor. I have crazy dry skin, I'm gonna go to a dermatologist. My hair is falling out, let me go get laser on my scalp.
Yeah.
All these things, and it's like it truly becomes like this treasure hunt of figuring out all these different, doctors to manage symptoms, and if they just had their hormones really looked at, balanced out, I mean, it could save a lot of money, a lot of time, a lot of
Heartache.
frustration,
Yeah.
heartache, and also too, like, women during this time just feel just not as good about themselves, I think a lot of times too, just feel like, "Man, I don't have it going on like I used to," and it's like, it can be really hard on ourselves? So it's a mental
Yeah.
thing too, big
Oh
time.
my gosh, 100%. And I do want to say in the definitions of perimenopause and menopause, assuming you still have your uterus and you're still cycling, that lab testing doesn't come into play of the definition. There's no lab
Mhm.
test to determine in that instance, are you perimenopausal? It's age and symptoms that we look at. Again, if you've had a hysterectomy or an ablation, we do use that lab test FSH.
Mhm.
However, you will see on social media that some experts believe that means you should not test. Like we don't use testing to determine perimenopause. We use age and symptoms. Again, as I mentioned, some fatigue or weight gain or hair loss as an example. And so if you're 45 and experiencing those, you automatically get the stamp of you're perimenopausal, like welcome to the club.
Mhm.
However, as I stated, what if this whole time you've had a thyroid problem? What if this whole
Right.
time you've been anemic? What if this whole time you're pre-diabetic or your insulin is high, so you're insulin resistant or you're low in vitamin D or whatever the case may be? I still advocate for lab work because I still want to make sure you're healthy underneath
Right.
it all and you're going to thrive. And as I said, you can still be in perimenopause.
Right.
And those, when you add all that together, of course, you're not going to feel on the top of your game. If you feel like you're going through reverse puberty, if all 12 systems are changing, therefore it's affecting other hormones or other nutrients or what have you. Like, no wonder women are like, I don't have the oomph like I used to. My mood is way worse. I'm feeling less connected. Maybe I have more anxiety. I'm not as motivated as I was. Like, I know. And
Yeah.
now, finally, thank goodness, they're doing all sorts of research on this, which, on the one hand, I'm glad to have it in an evidence-based paper. But on the other hand, all you have to do is ask women. They'll tell you. Like, this
Yeah.
going through this stage, they feel like they have changed nothing, and yet everything is changing. And the lack of control, losing control, is a massive stressor to the body. When we talk about stress, we talk about, saber-toothed tigers, but then we also talk about, stressful emails or work or kids or relationships or bacteria and viruses, the news, what have you. But
Mhm.
not having control, feeling out of control is also a massive stressor to the body. And if you're
100%.
if you're feeling out of control in your own body, because nobody has taught you about hormones or this whole transition, oh my gosh, the amount of frustration and heartache is just huge.
Yep. Yep. Absolutely. Wow. And when you like you said, you're eating the same way, exercising, like, all the same things you did, and it's not working, you just really can feel like a failure. And then it
Yes.
affects marriages so much, parenting so much. I remember as a teenager, my mom going through menopause, and it was like World War III in the house.
Yes.
So, and I had a
Yeah.
thyroid problem. So I was freezing all the time and I didn't know at the time. And she was having hot flashes. So it was like we would just battle over the thermostat. It really does affect life so much. And the more that women know this, the more they can at least have compassion for themselves, understand themselves, and be able to communicate that with their partner so that they're on the same page too, and they can, kind of walk through this together.
Yeah.
I mean, I'm sure so many divorces happened with this being a big factor,
Yeah, and I
big
I
time.
hear that over and over that
Mhm.
this and I'll be honest, I haven't looked at the actual statistics, but just anecdotally out of the mouths of women, I hear a lot of like, "Oh yeah, I was in my 40s or in my 50s." And I in the the amount of women who tell me that they hit this age and then their boundaries become really strong. They use the word
Right.
no more often. They're figuring out who they are. I mean, there's a lot of benefit to going through this transition. I know it can sound
Mhm.
all doom and gloom, but like you're going to come out the other end just this whole new amazing goddess, right?
Mm-hmm.
However, that means you put up with less crap and you set harder boundaries. And if you've been tolerating or people pleasing or living for everyone else for decades, including your partner, then you're done with it. And that can be
Yep.
a real big jolt to everyone. And they're not willing to change because they like the way you people pleased and, put everyone else
Mm-hmm.
first
Work
for
for
the last
them.
couple of
Yeah.
decades. It worked for them. They didn't have to work very hard. That, yes. So anecdotally, I absolutely see women that are like, man, I hit perimenopause and I was done. And I was like,
Yes.
yeah,
I
it
remember when I
happens.
was shadowing you back in the day, that was one of the things you said is press the no button more. That was like on your
Yes.
actual treatment plan
Yep.
for someone.
Press the no button more.
Yep.
Yep. Set those boundaries.
So let's draw a comparison from how maybe a conventional, doctor may approach this for a woman compared to like how we would work with a patient.
Conventionally, in my experience, often, and this is slowly like a cruise ship starting to change, but
Mhm.
conventionally for a long, long time, they didn't. It's not that they didn't recognize perimenopause like it didn't exist, but they didn't really have a great offering for it. Short like the birth control pill, the IUD. Sometimes they would use hormone therapies, but not often in what
Mhm.
I observed in, being in
Same.
the medical care for a long time.
Yeah.
And that is starting to change where they didn't teach very much about perimenopause and menopause in medical school. And thankfully in 2024, we're starting to see that a tiny bit more because of social media and all the books that are being written. So I'm hoping in the next 5 to 10 years, which I know is way too long, but whatever, that we are going to start seeing an influx of primary care and OBGYN who understand perimenopause and menopause. So right now, if you have gone to your primary care or OBGYN and said, I'm this age, I think I'm perimenopausal, and they didn't have a lot of great offerings for you, or they just handed you the birth control pill, you're not alone. And that's kind of been the standard of care for, unfortunately, a while.
Yeah.
Whereas on the flip side, like you and me, who've been practicing in a completely different paradigm, we take a whole person approach. We understand what's going on with these hormones. They're affecting all 12 systems. It's a process of going through perimenopause into menopause. It includes hormones, it includes diet, it includes lifestyle, it includes, gut health, it includes movement. Like it becomes this, like you're making big changes. It's like remodeling your house and living through it. And we recognize that. We recognize that we have to really understand all aspects of the house, including different lab work, and then pulling that together for you, for the person who is really struggling with their hormones. And for a
Mhm.
while, this really clashed because I would have conventional doctors who would say, that's you're a quack, that's not going to work, that's not how we do things. And I'm like, that's not how you do things, but it is how we do things. And thankfully, ever so slowly, that is starting to change. Where even
Mhm.
my own OBGYN, when I was in my late 30s, she was at the time 47. And I said, what are you doing for menopause? She said, I'm on the birth control pill. And I said, why? And she said, well, that's what I have. That's all that I know. And it's working for me.
Mhm.
And now that is starting to change where people are starting to recommend some lifestyle support. They're recommending hormones. If somebody is a candidate, they're looking at cognitive behavioral therapy, like therapy
Mhm.
support as you're making this big transition. And so, like, little by little, this is sort of eking out. But if you have felt like you've hit a brick wall, if you have felt like you've been uh, pushed down, pushed aside as far as, this hormonal shift that you're going through, one, you're
Yeah.
not alone, and two, it's totally okay to find a new practitioner.
Totally. Finding a doctor is like dating. You should just feel
Yes.
as you leave that visit, go, that was a good date. That's how it should feel. It shouldn't be like, all
Yes.
right, we'll see how it goes. Like you don't need to try to
Yeah.
make it work.
Thanks.
So
Yeah,
we talked
thanks.
about some of the symptoms with this stage. What's actually happening, with these hormones? What's occurring, under the hood?
So when you get a cycle, picture a roller coaster. So anyone who's been to Disneyland, Disney World, Six Flags, any of the big ones out there, you see a roller coaster, it's the same. It's a set track. When you
Mhm.
get your period, you're on a set track. So estrogen and progesterone, you sort of go up, go down. There's a loop-de-loop, that's ovulation, and then we have up, down again. And it's that way month after month, ideally, until you get into perimenopause, unfortunately, then the roller coaster can go off the track. And
You
now things
fly off
you
of the roller
fly off. Like
coaster.
all of a sudden it's two loop-de-loops and it's flat for a while and it's the highest peak you've ever been on. And it can really feel that way depending on the month. So these hormones that are used to being on a very set track go off track. And the first one to go off track is progesterone. So progesterone is a hormone. It's soothing, it's calming. It is the anti-PMS. It is the anti-heavy period. It helps make nice periods. It's the progestation. It's what helps with pregnancy. But it's made after ovulation. So you release the egg. If whether or not you're looking to get pregnant, you still release the egg and then you make progesterone. Well, ovulation starts to go. It starts to decline as we hit our 40s. And so for a lot of women, that's the first hormone to drop, progesterone. So what do they say? I can't sleep. I can't sleep. I feel more anxious. I'm definitely irritated. I don't have patience. My periods are heavier. My PMS is worse. In fact, I think I might have PMDD, premenstrual
Mhm.
dysphoric disorder, right? So progesterone's the first to go down. Eventually, over time, the more periods you skip, estrogen goes down. So your production of estrogen, specifically a big one called estradiol, drops down as well. And now we start to experience the brain fog, the hot flashes, the night sweats, the joint pain, the muscle pains, the dry vagina, etc., because estrogen plays such a big role there. So as these two hormones are dropping down, you can see how all these symptoms are showing up in all the systems of your body. And for a while, it was confusing. Why am I in my 40s, but I have frozen shoulder? What's that about? Why am I 40s, but I've been, or early 50s, and been told I have fibromyalgia? Why am I in this particular age and my autoimmune is either worse or maybe even better, on the flip side? Why do I
Right.
suddenly have anxiety or depression when I never had that my whole life? Why can I suddenly not sleep when I used to sleep great my whole life? I used to hit the pillow and fall asleep, and now I lay awake at 4 a.m. And
Yep.
it's because estrogen and progesterone receptors are all over the body. And because estrogen in particular is the big one for us women, it really is potent and powerful, that estradiol. It's she's the queen and she really plays a role. So if your different systems aren't getting that estrogen stimulation throughout the month, then they're going to suffer and subsequently we suffer.
100%. That's why when a woman is pregnant, she can feel like a whole different person because hormones are off the charts again, right?
Flooded her system. Yes, it's
Yep.
why for not, I get it, for not everybody who's pregnant, but like for a lot of pregnant women, like their hair is super thick and luxurious. Their skin is often at some point like, super shiny and luxurious, and they just
Hmm.
feel really good. Now, I get it, not everybody. However, we do hear this a lot because when you have all the lush hormone flooding the system, like you
Yeah,
feel lush.
exactly. And you brought up the autoimmune piece. I've seen this with a lot of patients when they're pregnant, their autoimmune symptoms are, way less as a result. So,
Yeah. And
um,
autoimmune and going through the menopausal transition it can be really interesting. So depending on which autoimmune you have,
mhm,
estrogen can be very supportive, or it can be very hurtful, depending. It's
right,
sort of right. And so some women who have certain autoimmune may notice like, oh my gosh, my autoimmune is worse at my period or at ovulation. Like it's very cycle specific.
right.
And then they go through menopause and they're like, thank you,
Yep,
Jesus, like it's all good.
yep.
I feel so much better. And then others are the
Mhm,
opposite. Their autoimmune feel pretty good through their cycling years and they get into perimenopause and they go, oh, I'm flaring. Like I'm having flares
right.
left and right. Now, estrogen in particular plays a huge, massive role in the immune system. We have estrogen receptors on almost all of our immune cells, all of them. And so when you lose that estrogen, well, first estrogen will go through these crazy kind of up downs because again, your roller coaster is going off the rails. So it's not as consistent as it used to be. And that way women kind of feel this like, oh my gosh, my autoimmune is flaring. I don't know what's going on. It's good, it's bad, it's good, it's bad. And then the estrogen drops down. And so that's why women can have an increased risk of even developing autoimmune as they go through the perimenopausal transition because of such interplay between estrogen and your immune system.
Mhm. I love that histamine has been put on the map a lot more lately, and I'm seeing so many of
Yes.
my patients dealing with this. So, what's that histamine connection?
So estrogen in particular plays a really big role in the clearance or the breakdown of histamine. And so if you
Mhm,
have a lot of estrogen, if you are in a state of these surges with tons of estrogen, then you're actually going to have one, the release of histamine out of your mast cells, and two, it's not going to break down, it's going to hang out longer. So it's
mhm,
it's like the trash can't get taken out. And so now you're reacting more and you're feeling more sensitive and you're feeling more histamine symptoms because you literally have more histamine floating around in your system. And what's
mhm.
interesting too is that that can then track with other little kind of hormone-like molecules called prostaglandins, and prostaglandins cause things to squeeze. So women will report, my cramps are worse, or I'm having abdominal cramps or intestinal cramps. And they go together. If you have a lot of estrogen, a lot of histamine, a lot of prostaglandins, it can make
Mm-hmm.
all that feel worse down in that, uterine area, intestinal area. And
Right.
speaking of intestines, estrogen and progesterone play a big role in our GI tract, like a
Mm-hmm.
massive role. And this is starting to come out in the literature a lot stronger, thank goodness. But when we lose our estrogen and progesterone, we get what's called leaky gut more significantly. So if you think of your intestinal tract like a fence line, and you have gates in your fence line, and the gates allow things to come through that are supposed to or have been, allowed to. But if you start to have gates that are broken or are off their hinges or don't lock, they just open for anyone. We call that
Mm-hmm.
leaky gut. Anything can get through the gates. And we have it in our intestines, and estrogen and progesterone play a role in our gate system, essentially in our intestines, and we're more
Mm-hmm.
prone to leakiness. Now, what does that mean? Well, that means things that shouldn't leak through the gate leak through the gate. And when they leak through the gate, the immune system now has to deal with it. So if it's a bacteria or a virus or a piece of food that's not supposed to go through the gate, the immune system goes, oh, this is annoying. And it deals with it. Now, what does it do when it puts out a lot of inflammation? You get a lot of
Mm-hmm.
inflammatory messages. And so the act of estrogen progesterone going down, causing the leaky gut, causing things to cross through into your body out of your gates, creates mild to medium to high levels of inflammation in the body. I was talking with a microbiologist not long ago who said, yeah, women going through perimenopause, like they don't change anything as far as what would trigger inflammation, but just the act of their hormone changes. It's like a number one reason for mild, low grade inflammation because it's all seeping through their intestinal tract. The gates are broken. And I was like, that's so not fair.
So not
That's
fair.
so not fair. At what point do we get a crown or a watch or certificate of like, hey, congratulations, you had periods. If you did the baby thing, you carried a baby or
Yeah.
four, here's your crown. Nope, we get more inflammation and a lot of these symptoms if we just let it go unchecked. Thankfully, there's a
Right.
lot you can do.
Mm-hmm.
Um,
Which
but
we'll get to
but this
shortly.
is
But
what a lot
yeah.
of women have been dealing with for decades.
Mm-hmm. Yeah. It ain't right, man.
It ain't right, man.
So let's give women some hope.
Let's
So
yeah.
yeah. So let's say for like you're saying, being able to manage this in a way, if a woman listening, maybe this is before she's noticing these signs or she's starting to feel these things, showing up. How can she help to address this to where she's not going to be getting this, increasing inflammation? Because we know inflammation is the common theme with all our major diseases
Yeah.
in our country,
Yeah.
autoimmune, cancer, stroke, diabetes, what have you. It all has that common thread of inflammation. So having low inflammation majorly decreases the risk of this across the
Mhm.
board.
Yep.
So what can these ladies do?
So a lot of it starts, there's two sides of this coin. One are the foundations, which we'll talk about, and the other side are
Mhm.
hormones, meaning like
Mhm.
hormone replacement therapy. You need both to make a full coin. Hormones like estrogen, for example, isn't going to fix what's at the end of your fork. And what's at the end of your fork is not necessarily going to replace all the estrogen you've lost. But
Mhm.
let's start with the foundational stuff. So, inflammation, we can get that a lot through what we eat, how we eat, blood sugar, which is glucose, and insulin. So, we need to be looking at, are we getting enough protein? Are we eating regularly? Are we getting enough fiber? Are we eating a colorful diet so we get all the nutrients that we need to make our body go round? And I know
Mhm.
this can seem boring or basic or like eye rolly, but now is the time you really do have to tighten up. If you're just eating, an egg in the morning and a salad with a little bit of chicken at night and maybe a repeat at dinner, you're not getting enough protein. And protein is really key here because we need a part of that protein to help us stimulate muscle synthesis or muscle growth. So on top of the protein and the fiber and the colorful vegetables and the nutrients, we need to be building muscle. At this
Mhm.
point, as we get older, our ability to build muscle really declines. It can decline
Yeah.
if we haven't been keeping after it. And it's our muscle, having quality muscle on us, that really helps keep inflammation down. It helps keep our glucose and insulin in check. It keeps us mobile. It keeps us from being frail. It reduces our risk of things like osteoporosis and osteopenia. So we need this muscle because it's a pretty active gland, right? Or endocrine organ in our body. So
Mm-hmm.
if you're listening to this thinking, well, I like the elliptical, I like the stair, like I'm more of a cardio bunny, I need you to start switching out and building some muscle, maintaining your muscle at the very least, because it gets a lot harder as you get older. So
Yeah.
dietary is one, muscle is another, focusing really hard on things like sleep, which can be hard because you're not sleeping very well. So what can we do to help your sleep? Because the better you sleep, the more glucose and insulin tolerance you have, it'll be sensitivity, which is a good thing. The less inflammation you have, the better your body repairs through the night. That's in our deep sleep is a big part where we detox and repair our body. So
Mm-hmm.
what are you doing before bed? Are you big on TV? Are you, bright lights? Are you drinking alcohol? Are you eating late meals? Are you going out all the time with friends? Just being mindful of this. Can we switch it? Can we start switching to maybe don't watch TV right up until the point where you go to bed? Maybe start cutting back on that alcohol. Maybe start getting a wind down routine. Can we do sleepy time tea? Can we start reading a real book? Maybe consider blue light blocking glasses. Like some of these things, you may be like, that's what I do for my toddler. I'm like, I know. And as we get older, we have to do it for us too. I'm so sorry to say
Mm-hmm.
this. And then the last aspect, there are a lot of aspects, don't get me wrong, but just to keep this digestible, the last aspect is what around your nervous system or your stress system. So these are the things like, are you saying no? Are you setting boundaries? Are you happy? Do you have joy in your life? Do you have a community that you can rely on and that love you and you love them? Do you feel safe? These all become really key as we get older because our tolerance for stress and our tolerance for not fear and anger and it goes down because our hormones went down and our
Right.
hormones helped us be a lot more resilient. So what can we do to help build our joy and happiness resiliency, our community resiliency, our boundaries resiliency? And that will play a big role on that side of the coin.
Mm-hmm. I love this. So good. And and it's all individualized too, right? You got to figure out what
100%.
works for you and helps you feel the best. And um, one of my things I've talked about with patients a lot is changing their relationship with stress. Because
Hmm.
the way I practiced before was a lot like try to reduce stress, reduce stress, reduce stress. Like it's so bad for you, but it really is also how you view your stress in your life. If you see it like bring it on, I got this, that's very different than this is going to kill me, you
Right.
know?
Right.
I remember seeing a TED talk called how to, what is it, making stress your friend or how to make stress your friend. Carrie
Yeah. Yeah.
McGonigal. That
Yeah.
was amazing. So highly encourage people to watch that if you feel like you're a stressed person. Let's
Even
talk about the
and
hormone side. Oh, go
well,
ahead.
I would so going with the stress, there are different levels of stress.
Yes.
In your body doesn't know the difference between actual stress, anticipated stress, and imagined stress. So I talk a lot to patients of like actual stress. Whatever, you're $10,000 in debt and you keep, bill collectors are calling, like that's actual stress for sure. Anticipated stress is you're $10,000 in debt and like, you're kind of ruminating over the fact of like, oof, in the mail today, I bet I'm going to get another letter saying I owe more money. Stressful.
Right.
Imagined stress is when you are imagining situations that don't actually exist. So maybe you're not $10,000 in debt. Maybe in fact you have $10,000 in the bank. But because you worry about everything, you're like, oh, I don't know, that's too expensive. I'm not sure. That'll put me in debt. I don't know if I could pay for it. And all of a sudden you've imagined yourself into a scenario that's not even happened yet or maybe was never going to happen. So you're a make a mountain out of molehill person. So when
Mm-hmm.
I'm talking to people about stress, I'm like, which category do you find yourself in? If you're always in the worry wart, high expectations, mountains out of molehills, like that we absolutely have to shift because your body doesn't
Mm-hmm.
know the difference. All it hears
100%.
is you freaking out and worrying and ruminating, and it triggers that system like, well, there's got to be something around me that I need to
Mm-hmm.
fight. And
Yeah.
so a lot of that psychosocial emotional stress, I invite people to re-examine. Things like, are you a controlling person? Are you a high expectations person? Like, do you get disappointed a lot? Like some of these things are noble in some regard, but they could also be holding your health back in a lot of others.
Mm-hmm. Totally. Do you have, while we're finishing up on this piece, do you have a favorite type of like strategy or modality to help with like limbic system healing, neurological healing?
Yeah,
I've
yes.
I've talked about a lot more with patients, like DNRS, primal trust. Like we've talked about different strategies, but I was curious. for you?
I like Primal Trust. I actually just interviewed her. That's definitely a good one. But I
Hmm.
th to keep it like super simple in,
Yeah.
today's talk, when we're looking at the hierarchy of are you in a sympathetic state, which is fight or flight, or are you in a rest and digest state, which is the heal and the repair and all those things. One of the big things is like, are you safe? Do you feel safe? Are you with community? And are you playing? Do you have playfulness? And so that's, while I love all those programs, and that's probably other podcasts for another time. Like the easiest thing I ask people is like, do you get any play in your day? Is there any
Mm.
joy in your day at all? And if not, or it's very little, let's start building that. Let's start making your body feel safe. And there are a lot of ways to help the nervous system feel safe. But at the core,
Hmm.
a lot of it is, it's hard to have fear if you're genuinely in a joyful mood. It's hard to have fear, be fear-based or anger-based when you're genuinely playing and having a good time. So what can we do? And that's even little things like your friend sends you a meme, your 4-year-old tells you a joke, you see a really cute cat outside. Like these little bits of joy, little glimmers in your day
Yep.
do truly add up.
I love that. Collect the glimmers. All right,
Yes.
let's final stuff on hormones. So strategies with
Yes.
hormones. Yeah, let's do it.
Yeah. So I am a fan of hormones. I'll just put that right out there.
Same.
Right?
I'm a
Like I
fan.
am pro hormone. I understand it is very personalized and individualized. So I understand the caveats, just like Lauren does.
Hmm.
So there are different types of hormones. There's progesterone, there are estrogens with an S, there's testosterone, and there's DHEA. So depending on where you're at in your transition of the perimenopausal journey, depending what you need, depending what you're a candidate for, we have options when it comes to hormones.
Hmm.
As I said, the hormones cannot change any of the lifestyle foundational factors, but they also can make a massive difference. I have a lot of women that say, and you probably do too, I do all the things. Lauren, I do all the things. And it wasn't until I added in hormones that finally, like the cherry on the sundae, like finally
Yep.
I felt myself, things got better, like, oh, that's what I needed.
Mm-hmm.
And so progesterone comes as creams, it comes as capsules, topical, or think capsules and or gel caps is what I was trying to say.
Hmm.
Vaginal, there's all sorts of options for progesterone. Again, calming, soothing, relaxing, sleep, easier periods, easier PMS. Estrogen touches on all 12 systems of the body. Hot flashes, night sweats, brain fog, muscle stuff, joints, um, uh, vaginal dryness, hair, skin. Like estrogen plays a big role in all of that.
Hmm.
Testosterone we commonly think of it as a male hormone. Women actually have a lot of testosterone, and it's important for bones, it's important for mood, it's important for libido. So, depending who you are and what you need, we can pull from these hormones.
Hmm. Yeah. And sex drive, a big one. I feel like doctors talk a lot about DHEA and testosterone for sex drive, but estrogen is such a huge one for sex drive.
Even progesterone, if you're anxious all the time, you are probably
Yeah,
not in the mood. If you're not
probably not.
sleeping, you're probably not in the mood. If
Yep.
you're up to, your forehead with irritation, you're not in the mood. So if we get these hormones right, then in your anxiety then you may feel more loving. Doesn't mean you're
Hmm.
like going to be back to the sex drive you had as maybe a young person, but
Hmm.
maybe
Yeah.
if we can get a lot of that, even the psychosocial feeling better. If
Hmm.
you're in joint pain, you're not going to want to have sex, right? If you're
Yeah,
feeling like you have fibromyalgia and everything hurts, but then we can address that, then you may be more receptive if that's
absolutely.
something you want.
Yeah. When you feel happier and more balanced, that can equate to the bedroom as
Yeah,
well.
100%.
Do you have any like preference for like static dosing versus like physiological rhythmic dosing? Like, what are your thoughts on that?
Yeah. Well, first of all, this is super controversial, right?
I
So the
know
North
it
American
is.
Menopause Society, or the Menopause Society now is what it's called, they talk about if you're doing hormones, like for example, like estrogen, it's like use a patch or use a pill, and it's very consistent. Progesterone, you can do static, which is every day, or you can cycle, kind of 12 to 14 days on, 12 to 14 days off.
Hmm.
Testosterone is usually very static as well, kind of every
Hmm.
day. And they don't believe in testing. So once you go on your dose, as long as your symptoms go away, then you're on the right dose. Now, what's interesting, and I think we're going to get more research articles on this right now when it comes to dosing, like by lab work. What we tend to look at are the bone health lab studies. So if
Mhm.
you're on estrogen and we test your estrogen in blood, your estradiol, we want it to be above 60 picograms. If
Mhm.
it's not, you're at a higher risk for bone loss, osteoporosis, osteopenia. So my osteoporosis experts are like, I test because I want her to be above 60. And a lot of
Yeah.
times it's higher than that. It's 100 or higher. And that's not often discussed in the guidelines or by the societies. Um, they're a lot more basic's not a right word, but they're a lot more in general. They have to talk to the
Yeah.
whole public versus just the subset that we're working, bone
For
loss.
sure.
So what do I do? So I do test. I believe in testing for things like this.
Mhm.
I do
Agreed.
cycle progesterone, especially if somebody still gets her period. So I'm a great example. At the time of our interview, I'm 47 and a half. I still get my period, but I don't make a lot of progesterone after ovulation. So I do
Mhm.
progesterone only in the second half of my cycle, the luteal phase. So I cycle it. Now, once I'm fully menopausal, I'll probably keep cycling it because we're starting to see, again, in the bone research, the pulsing in and out of progesterone, cycling 12 to 14 days off, pulling it out, is helpful at stimulating receptors in the bone. Like
Right.
in your younger years, you cycle, remember the
Mhm.
controlled roller coaster, and the up down of these hormones was pulsing receptors on and off. Like,
Right.
go, you go, stick out, do your thing. Okay, you're done. Come back in the cell. Don't do your thing. So it's this
Mhm.
in and out, back and forth. And not all women respond well to that. I fully understand. And a lot of menopausal women like one dose all the time, don't stop. And others feel really good with the cycling, the pulsing method, specifically of progesterone.
Mhm.
So again, I'm very personalized, and I'm very open to both. If you like one dose to rule them all and you do it all the time and you feel great living your
Mhm.
life, fantastic. And if you're
Mhm.
not, let's try something different.
Mhm. What about using physiological dosing, like of estrogen, for example?
Again, so physiologic dosing, and it depends what you mean by physiologic. So when a woman is like on her period, for example,
Mhm.
her estrogen levels are really quite low. They're generally under 30 picograms
Mhm.
per ml. And that's physiologic, which means what the body makes. If she
Right.
gets closer to ovulation, it can go up to 500. I mean, it can be a
Right.
massive rise, right? And that's
Mhm.
considered normal, acceptable, and physiologic. So again, when I'm testing for bone health in particular and following my osteoporosis friends, they're generally looking at the somewhere between 60 and 80, maybe even 60 and 100 picograms, which can be like some guidelines that blows their mind. They're like, no, no, no,
Mhm.
no, it's around 35 is what we want to go for. I'm like,
Yeah.
but I'm
No.
trusting these osteoporosis experts,
Right.
these orthopedic surgeons who do get into osteoporosis, and I mean,
Mhm.
I kind of want to protect my bone. So when you say physiologic, being
I guess
above
I mean
60,
doses that mimic what your hormones looked like back when you were of childbearing years
oh,
and to
there
where,
are, oh, I see.
still
Yeah.
having a bleed every cycle,
You
even into the postmenopausal years.
So just cycling progesterone, which the Menopause Society suggests is an option, is you can do 12 to
Mhm.
14 days of progesterone um, on and then, and then stop for 12 to 14 days. Just that alone might stimulate bleeding
Mhm. Right.
without even meaning to, not even trying to be physiologic. But there are definitely practitioners who change the dose every couple of days. So they're changing
Mhm.
estrogen, they're mimicking essentially. So you're like low, then
Right.
you go high as
So
if
it's
you were
kind of like
ovulating,
Wiley method, but
back down.
but
Yeah.
something a little bit different. But
I was
I have some patients who do it and they feel like $1,000,000. Their
yeah,
labs look good, their bones look good, they're running marathons. Like
yeah.
they seem to fare a bit differently than some of the other patients. So
And I've
it's
seen
interesting.
both. I've seen
Mhm.
people do the protocols and be fantastic, and some people do
Right.
the protocols and it like
Doesn't
pushed them
work.
right into, yeah, they're like angry and gained a bunch of
Right.
weight and they started
Yep.
bleeding all the time, and so I don't ever, I guess I should say, I don't start out with that. I'm
Right.
more of a
Right.
like, let's ease you in and then go up from there.
Mhm, and I have my view on that too. It's like we wanna do more than just symptom relief. We wanna make sure this is actually creating some real benefit in your body
Yeah,
beyond you just feeling better,
right.
like you said,
Yeah.
bone health and all that kinda stuff. So,
They
brain
the
health.
the
Yeah.
longevity doctors, they talk about it as the four horsemen, the four horsewomen of the apocalypse. So we're trying to
Mhm,
protect against cancer, neurodegenerative, so brain,
mhm,
cardiometabolic, so heart and like diabetes, and then
mhm,
frailty. So think of like falls, broken
Yeah.
things and osteoporosis. Now, again, the bone research is what we have the most on. I'm very hopeful that some of the brain researchers, such as Dr. Mosconi, Dr. Niotis, that they will start to look at like at what estrogen level as an example. Are we seeing big improvements? Maybe in brain health, maybe not. Same for cardiovascular. If somebody starts early enough with their estrogen and maintains a certain estrogen level, do they have less risk for the cardiometabolic later in life? We don't have that
Yeah.
data yet, not
Right.
consistently at all. We need to move in that direction to help guide the general more. Right now, like I
For
said, all we
sure.
have really, it seems, is just the bone data.
Yeah. It seems like this is
There's
an
some heart.
exploding area though of
It is an
research.
exploding area. Yeah.
So it's
Yeah.
exciting. A lot more for
Very.
women coming. So yay. Okay.
I
Any
know.
last little talking points on this? I think we covered a lot of ground, but was there anything else that
Yes.
I
Yeah, the big thing is just that this whole transition is not a disease, but it can feel
thank
like
you?
one, right? Like
Yes.
it's a rite of passage that we all go through, and it it's some form of another, even if you've had a hysterectomy, like it's some like you went through something with your hormones. And there's a lot we can do to be proactive. Like Glinda the Good Witch said, you had the power all along, my dear, right? And it can feel like you don't
Yeah.
because no one's educated about, your mom probably hasn't talked about it, your grandma sure never talked about it. And that tide is changing. And so now, thankfully, there's so much more education, like you and your podcast, that are getting it out there so that women can go, hold on, this isn't working for me, and I'm going to make changes, and I'm going to, interview some new practitioners, and I'm going to read some books and listen to podcasts and figure this out.
Yes. Yes. Thanks to you and all the help you're doing. And we're walking through it personally. So we get to,
Yes,
take people along the way.
we sure are.
So yeah. Well, thank you. Thank you for being generous with your time. Again, I think the third or fourth time.
I love it.
I think fourth time officially. Yeah. I'll put the previous show link in the show notes too, so you guys can check out our past episodes. But thank you so much. Love you so much. So proud
Love
of
you.
you. And
Love,
let me know if
same.
there's anything I do to support you, and we'll talk to you soon.
Thank you.
All right. Bye.